We have a problem in patient care where so many patients are told, and you may be one of those patients, that your labs, their labs are normal. Um, and it's just depression that you're experiencing, or you'll get over it. When it's not depression and you won't get over it, and your labs are not normal, they may be in range, but they're not actually normal or ideal for you. And this is often a thing with ferritin, where your ideal ferritin level is not necessarily the normal ferritin level. And ferritin is the gold standard for iron deficiency or sufficiency. Understand that just because there are normal levels on labs, it doesn't mean that if you fall into that normal category, that your levels for yourself are normal, or potentially anywhere near or close to optimal. Recently, I had a individual, a lady, send me a message stating that her labs came back and her ferritin was at 21, and her physician told her that her levels are normal, and her symptoms that she was experiencing were not from low ferritin, because her ferritin was within normal range at 21. Now, let me remind you that the normal range for most labs for ferritin is anywhere from 15 on the low side to 150 on the high side for women. It goes up to 400 for men. So it's a pretty big range, right? Sure, she fell within the normal range at 21, but her life experience demonstrated that 21 was nowhere near her optimal life performance, feeling amazing level. She had said that back 7 years earlier, she had a ferritin level checked, and it was 122, which is still within the normal range, right? But then, back then at 122, she felt amazing. She was working out 5 days a week, breastfeeding, and she was just 9 months postpartum at that point. And yet her body was responding awesomely, and she was able, she felt great. Now, 7 years later, she's being told that even though she doesn't feel awesome, she doesn't feel amazing, she's sluggish, her body's not responding like she would want to respond, and her ferritin is 21, that's good. That's normal for her. This is, of course, not normal. This is not true for this woman, and I would venture to say that for many of you, this is the case as well. I literally cannot say that I've ever seen a man or a woman with a ferritin of 21, though that's within the normal range for ferritin, who had optimal life function, who was functioning at optimally, who had great energy, amazing recovery, those kind of things. I mean, if you had lost hair because of ferritin levels being low or iron levels being low, most people will not see any regrowth of their hair, or their hair won't stop breaking off until their ferritin is at least 50. And there's other studies showing up to 70 you need it before the hair will start regrowing itself. So optimal ferritin is a big, big deal. I bring this woman's story up because time after time, patients with symptoms that don't fit a particular diagnosis, you're not all the way iron deficient, you're not all the way anemic, you're not all the way hypothyroid. There's not this diagnostic category to stick them into, because their labs are within the normal range. There's no verified deficiency on labs. They're told they're normal, when literally it's the simplest thing to help them get where they want to get feeling amazing again. Like getting their iron levels up. That could literally be the difference for this person, and for so many people. One thing to consider is this, or across the board when you get labs done, thinking about diseases or feeling awesome in life, is common things happen commonly. So when we're talking about a lack of motivation, fatigue, dizziness, palpitations, brain fog, just kind of a general feeling of depression, or just literally decreased life performance, there is one nutrient that is commonly deficient and commonly causes those symptoms. And that nutrient, that mineral, is called iron. It's the most common nutrient deficiency in the entire world. It's, over 1 billion people are considered to be iron deficient. So I'm Dr. Matt, and let's accumulate health through iron optimization.